Hi everyone, it's Eric from Strong Medicine. It's been Thanksgiving holiday week here in the U.S. Schools are out of session, and most people have other things on their mind than cardiovascular physiology or clinical reasoning. I know some of you are probably feeling anxious about the Omicron variant that first hit the news. I think like 2 days ago. All I have to say about it today is that we just don't have enough data yet to say much of anything. Rumors of increased transmissibility and immune escape, I mean, they're just speculation for now. Instead, I thought I would take today to talk about something different and more personal than that has been weighing heavily on my mind for a bit longer. Throughout the pandemic, it's been my impression that many healthcare workers have felt something very deep and fundamental change in the relationship between us and the system, between us and the collective layperson public, and between us and our individual patients. We have yo yoed from being initially hailed as heroes to quickly becoming objects of scorn for promoting vaccinations and being accused of all sorts of nefarious behavior wrapped within bizarre conspiracy theories. We've had to work under longer hours, under less safe conditions. Record numbers of healthcare workers have left their fields altogether in the last 18 months. There have been plenty of people who have talked about this general phenomenon, framing it in terms of either mental wellness or moral injury and or burnout. But while those closely related things are all major players in this fundamental change to which I'm referring, there's a critical component that's been missing. Healthcare workers, we've lost our empathy, and both the public and ourselves have suffered because of it. You know, I've I've struggled over whether or not to make this video because this topic is not going to sit well with everybody. So many awful things have happened to the healthcare professions during COVID that many of us rightly feel like victims, and as such, we can fall into the trap of using a reasonable explanation for what might be seen as a shortcoming as a justification for that shortcoming or as a way to pretend it doesn't even exist. The thing is, though, acknowledging our loss of empathy, it doesn't need to minimize the moral injury that we've suffered. The truth is, we're not infallible. We've made mistakes, and we need to talk about and understand them if we want to if we want to avoid continuing to make them. Moral injury, it's going to continue to happen to us throughout the pandemic and probably long after the pandemic is over. But we can change how moral injury affects us, and we can change how we respond to it. When I think about the concept of empathy, I consider it to be the ability to recognize, acknowledge, and to transiently experience another person's thoughts, emotions, and biases as if they are one's own. When you feel and demonstrate empathy, that doesn't mean that you are agreeing with another person's viewpoints, but instead you are experiencing the perspective from where those viewpoints and emotions originated. So, for example, when as a physician, I'm having a goals of care discussion with the child of a critically ill elderly patient with dementia, and that child is reluctant to designate the patient as DNR DNI. I'm not usually going to agree with the decision, and I'm going to work to change it. But empathy allows me to appreciate and understand why the child may want to keep their parent as full code. Having the empathy helps me strengthen the communication between us, and it helps the family know that I'm not in any way discounting their emotions. And ultimately, I think it makes it more likely that the patient receives the best possible care in the end. I didn't always have empathy in such situations. It's not something that comes naturally to many of us. It wasn't something that I personally learned in medical school, for example. For me, I think watching my father's illness and ultimate passing while in hospice helped me to see end of life decisions from other perspectives. But while personal experiences are helpful in becoming more empathic, they're not necessary. Empathy can be taught and it can be learned, and that's one of the many goals of current medical training. Unfortunately, with so many things related to COVID, we've gradually lost our empathy. We've lost our empathy when talking to a patient about alternative and unproven treatments, and when a person expresses reservations about vaccination, and when a parent wants to return to school or wants school to return to normal, or when a parent is worried that mandatory face masks will hinder their child's emotional development, and when a worker or business owner is worried about losing income due to business closures. And, we've lost our empathy when an anti-vaxxer becomes critically ill with COVID pneumonia and occupies one of our ICU beds for a month. I hear this when talking to people in real life, and in particular, I see it online. I've seen people, including physicians, writing and tweeting both mockingly and scornfully about unvaccinated anti-maskers who become sick, citing karma or some perverted notion of justice. I've also seen and heard physicians writing and tweeting mockingly and scornfully about their colleagues and peers who happen to have different opinions on things like vaccine mandates and masks and lockdowns, which, I gotta be honest, I think it's also a manifestation of lost empathy, as it results from an inability to view issues from alternative perspectives and to appreciate value in hearing opposing viewpoints, even viewpoints which are based on inaccurate conclusions. This loss of empathy, it hasn't just been experienced by healthcare professionals. It's not a phenomenon that's limited to us. You don't need to look any further than Reddit's horrific Herman Cain Award to see that. But it is the most notable when it's experienced by healthcare professionals because empathy is kind of central to our job descriptions. And what I think is interesting is that most of the people who are doing and saying these things, they're generally good, compassionate people for whom this would have been extremely uncharacteristic pre-COVID. And I certainly do not mean to be implying that I am personally above any of this, because I have felt this loss of empathy in myself, and it has taken a shockingly long time for me to see it. And that's partly why I wanted to talk about this. So why has this happened to us? I want to rewind the timeline back to March 2020. At the very start, we didn't seem to have support of national leaders. Hospitals had insufficient PPE. Some of our coworkers and colleagues became gravely ill themselves or even died. And then there was this moment, a brief moment during that April when the public was calling us heroes, which was certainly appreciated, even if not entirely accurate. But having that label, having us on a pedestal was a much needed morale boost. And then by summer, that was largely gone. People pushed conspiracy theories online that COVID was fake and overblown, that doctors were in on some grand conspiracy. When cases started rising again in the fall, while we were started working longer hours and working a greater number of shifts, many people accused us of lying about how full hospitals were. We were constantly worried about bringing the disease home to our families, while we were simultaneously being accused of lying on death certificates to make COVID seem more dangerous or more deadly than it was. Some physicians got harassed online or even in person. And all the while, half the politicians in this country, in the United States at least, continued to downplay the seriousness of the disease and publicly disparage the scientists and public health experts on whom healthcare professionals had been relying. The healthcare workers are heroes mindset, it didn't just evaporate, but it was flipped on its head, and many of us felt betrayed by both the public and our national and local leaders. Every lie we heard by a politician on TV, every tweet that we read that COVID is just the flu, every patient who argued with us that the vaccine itself has killed thousands, every hospital admin who tells us a family member of our dying patient is being denied visitation, it all added up to moral injury and our subsequent burnout. Even right now, as I'm recording this video, in response to news about the Omicron variant, the hashtag #DoNotComply in regards to mask mandates is trending on Twitter. So it's no wonder that our empathy was lost, or more accurately, that our empathy was taken from us. And that stolen empathy, that's followed by a loss of compassion. Although it's a seemingly an isolated example, I do want to do a deep dive on a recent exchange I witnessed on Reddit between self-identified healthcare professionals on the medicine subreddit. Someone posted a link there to an article in the UK newspaper, The Guardian, entitled Victoria AMA, as in Australian Medical Association, says COVID deniers and anti-vaxxers should opt out of the public health system and let nature run its course. In essence, these Australian physicians have made it their official professional position that if an anti-vaxxer develops COVID, they should not come to the hospital. What do you think what the response was to that article from anonymous healthcare professionals on Reddit? For one thing, the post received over 1,500 upvotes, the second most of the month. And while an individual upvote on Reddit does not necessarily indicate endorsement of the post by the voting individual, averaged out over thousands of votes, this meant that the majority of people in this subreddit of healthcare professionals felt the expressed viewpoint had merit. The post also generated a lot of interesting discussion. Arrow86 responded to the original post very simply, "Love it," which has received to date a net of 198 upvotes, which is a fair amount of upvotes for a comment on the sub. But it's the response to Arrow86 which is more important. The Merovingian responded, "Okay, then should everyone who makes bad health choices be encouraged to opt out of healthcare and let nature take its course? Smokers, alcoholics, drug addicts, morbidly obese, they should all opt out of receiving healthcare. What's the difference ethically between someone who makes poor choices with vaccinations to deny them healthcare when they get sick versus people who willfully make other poor health choices and then get sick?" Other users then responded to the Merovingian that it's a terrible analogy because COVID is contagious and those other illnesses are not, or more broadly, an anti-vax movement hurts the whole community. Users also objected to equating chronic hard-to-treat stigmatized conditions with receiving 2 injections in a drive-through clinic. One Redditor wrote, "No way you've actually been involved in COVID care and think this. The only problem with this declaration is that it doesn't go far enough. Those of us who actually do take care of COVID patients should be calling for anyone who has refused the vaccine to be denied all ICU level of care." At some point, the Merovingian edited his comment, which on Reddit is a totally acceptable practice, and adds some points of clarification and response. The Merovingian concluded with, "These are extremely radical ethical beliefs. You all realize that, right? Honestly, the hive mind desire to unethically refuse to treat patients in regards to anti-vaxxers in here is disturbing, and you should give your heads a shake, FFS, which stands for heaven's sake, shameful." And notably, the Merovingian comment, the thesis of which is that it is unethical to discourage anti-vaxxers from seeking medical care for COVID, received a net of 260 downvotes. To someone who does not hang out on the medicine subreddit, this may not be apparent to you, but that is an extraordinary tally for this sub. I cannot remember ever seeing a comment there downvoted so many times. Why have I focused on this one Reddit exchange? Who cares what 260 random, anonymous, self-identified healthcare professionals think? We should care because those 260 individuals represent the zeitgeist of how we collectively, as physicians, nurses, PAs, pharmacists, respiratory therapists, and students, currently view anti-vaxxers and the vaccine hesitant and anti-maskers and all other variations of COVID denialism. We view them as ignorant, uneducated, and selfish. We view them as incapable of participating rationally in shared decision-making discussions. And more of us than we would like to admit view them as undeserving of the same level of medical care as those from our own tribe of the masked and vaccinated. The Merovingian was 100% right when he stated that advising anti-vaxxers to not come to the hospital when sick with COVID is an extremely radical belief. The most recent comparison might be folks in the early 80s who claimed that we shouldn't be committing so much to treatment for patients with HIV because they only got HIV through drug use and sexual promiscuity. It was not uncommon for doctors and dentists in the mid-80s to refuse to treat patients with HIV, with the typical stated reason being fear for their personal safety. But there was a strong undercurrent of judgment of those patients and of their personal lifestyle choices. Luckily, this was quickly deemed unethical, and doctors and dentists who had refused care were publicly admonished. What would we say today about a doctor telling a patient with HIV that they should opt out of antiretrovirals because they made a conscious choice to have unprotected sex with a stranger? Such a doctor would rightfully be ostracized by their peers, and they may find their medical license in jeopardy. Is that different than saying an anti-vaxxer should not come to the hospital when they have COVID pneumonia? Another important aspect of our loss of empathy and compassion concerns when Redditors stated that getting a vaccine is much easier than losing weight or quitting smoking. And that probably seems obvious to you, but I don't think it's actually true. The limiting factor in getting a vaccine hesitant individual to get vaccinated is not sticking their shoulder with a needle or getting them to the clinic. The limiting factors are them getting past all of their biases and getting past all the misinformation with which they've been bombarded for 2 years. That is not remotely easy. There's a very old saying, there but for the grace of God go I. These days, it's largely lost its religious connotation, and in short, it means that the speaker has seen someone else befall a terrible fate that could easily have happened to themselves if it were not for circumstances beyond their control. So when you, the enlightened viewers, the enlightened vaccinated viewers of this video, see an anti-vaxxer become sick with COVID, consider that had you been born into a different family, lived in a different state, were surrounded by different friends, and had a social media recommendation algorithm nudge you in a slightly different way, that sick, unvaccinated COVID patient could easily be you. There are many societal, psychological, and physiological reasons why individuals become obese and become addicted to alcohol and drugs. Reasons that are honestly completely beyond the control of the individual. Adopting a vaccine-hesitant, anti-mask, anti-science mindset is not different than this. These individuals are also victims of circumstance. They don't need to be shamed or insulted. They need empathy and to be shown compassion, even when they're making seemingly unreasonable decisions that adversely affect the rest of us. In fact, maybe especially when they are making unreasonable decisions. What separates the follow the science tribe from the I do my own research tribe is paradoxically smaller in magnitude while being far greater in scope than is immediately apparent. The best approach to bridging the gaps between these tribes isn't shame or to compete for who can cast the most shade on Twitter. And the best approach is not even piling on more information with the hope that good information somehow dilutes out the bad. Instead, we should prioritize listening to the concerns of our patients and demonstrating that we want to understand their perspectives, even perspectives that feel inherently flawed or dangerous. That is hard sometimes, for me too, and it frequently does not work. Some folks have just fallen too far down the rabbit hole of misinformation and conspiracy theory to be pulled back up. But compassionate listening is still the most successful at changing people's behavior and decisions as compared to any of the alternatives. Empathy and compassion, they have always been among our best tools to overcome this pandemic. Yes, they've been driven away by the burnout and moral injury that many of us have experienced, but we as a collective whole, I don't think we've done enough to stop it. We've fallen victim ourselves to our own biases. We've fallen victim to tribalism, and in the case of some, by the psychological need to score meaningless internet points. I know that's hard to hear, and I imagine that some healthcare professionals watching this will feel like I'm victim blaming, or that I'm minimizing the shared trauma that we've experienced. I'm honestly not doing either of those things. It's just that it is possible to both be traumatized and to simultaneously have responded to that trauma in a suboptimal and occasionally dysfunctional way. The greatest irony with all of this is that while moral injury and burnout explain the trigger for our empathy disappearing, that missing core aspect of our profession further contributes to the burnout. It's a positive feedback cycle. Burnout begets loss of empathy, and loss of empathy begets burnout. So working hard to regain it, it doesn't just improve patient care or help in the ongoing battle against COVID. It also improves our own well-being. Unfortunately, too few healthcare professionals are acknowledging this has happened. As I said at the beginning, they talk about moral injury and they talk about burnout, but they leave the effect of lost empathy out of the conversation. Maybe it's because it feels like it's shifting blame. Yet, This has been central to how we've experienced and reacted to the pandemic. Rebuilding it within ourselves and within our profession, it's not an easy task. And I'm sorry to say that I don't have good strategies to share. But I do know that the first step is saying, this has happened and we should not be okay with it. Anyway, so those are just some things I've been thinking about over the Thanksgiving holiday. Thanks for sticking with me and watching to the end. We'll be back with some more conventional medical topics next week. Stay safe out there.